This virtual consultation is on lower blepharoplasty. That's the lower eyelid. So if you want to know about upper blepharoplasty, I encourage you to watch that video. Just like that video, I talk about in that video that I believe that the problem with the upper eyelids is that it has a little too much and a little too little. Too much skin, and in this case, too little fat or volume. Now, the lower eyelid is oftentimes, if you've just got a little bit of hollowness, I can oftentimes just do a little filler there and not necessarily need to do a blepharoplasty, and those little fillers start to last longer and longer. However, when there's an eye bag and there's crepey skin, it doesn't look that good, you can't fill that with fillers. You can't just fill up that volume to cover up that huge bag. You need to have that removed. So the way that I take out an eye bag is done with no incision. I always tell my patients that the reason I do that is not to save you a scar, although that's obviously a great thing not to have an incision over naked skin there, because that scar typically heals not so badly. The reason why I don't make an incision is that once you made the skin incision, that lower eyelid skin gets very weak, that muscle gets weaker, so you've got to resuspend it. It's like a rhinoplasty. When I open the nose immediately gets weaker, and I've got to rebuild the structure. So the same thing when you open an eyelid from the outside, you're going to have to rebuild it. The problem with the eyelid, to rebuild that structure, you've got to tighten the lid to the periosteum. And that lateral canthoplasty, or canthopexy, really canthopexy, is intended so the eyelid doesn't slip. The problem with that is if it's tightened just a millimeter too much, inward, outward, anywhere, your eyelid shape will change a little bit. And if the eyelid shape is pulled back, could look artificial, could look Asian. If it's pulled in, it can look distorted, it can look weird. So the canthus is the description of the joining of the upper and lower eyelids. When that canthus is distorted, it doesn't look natural and it doesn't look like you. So when I go through this transconjunctival approach, which is from the pink part of the eyelid, that's a no incision. In other words, there's no stitches, there's no skin cutting. I believe that not only is it a much faster recovery, but it's also much safer in the sense that there's almost, I shouldn't say no risk, but in 20 years I've never seen this, there's almost no risk of distortion of the eyelid. To me, that's the #1 reason I do this transconjunctival technique. So the transconjunctival technique, I protect the eyeball. I go from inside the eyelid area and I make a small little incision. It allows me to access the fat. A lot of people think, hey, it's all about sucking it out, cutting it out, but actually it's a gentle teasing process where I then cauterize the fat. There are usually 3 eye bags. There's one in here, there's one here, and one here. Not everyone has the outer one, but oftentimes it's there if you look. So I remove those little areas, and the cool thing with it is even though I'm making a little incision inside the eyelid, there are no stitches. It just heals up in a few days, which is really, really cool. The understanding, though, I want you to sort of understand the way that I look at the lower eyelid. I alluded to this earlier with the upper eyelid. There's a little problem of too much and too little. It's the same thing with the lower eye bag. Now, I'm 51, going on 52. I've got an eye bag here, if you can see it, and I've also got a hollowness. So if you look at me, I've got both problems, and I've got some wrinkles, okay? That's the glory of getting older. So the eye bag above it, okay, is what I remove through the no incision approach. But look, I've also got a hollow eye rim. So that hollow eye rim is what I do to add fat there. And so I encourage you to watch my video on fat grafting to understand more about it. So fat grafting to me is great. I can also do fillers, but as I said, if I'm gonna be taking out the bag surgically, there's no reason to go with fillers. I'm gonna be adding fat just because I'm doing surgery to surgery makes sense. So one thing people always ask is, hey, you know what, why are you taking fat out when you're putting fat in? Because again, the fat bag is here, the hollow rim is underneath it. So there's 2 separate areas. So I told you why I don't cut the skin. I also want to tell you there's an alternative way of taking the eye bag out, which is called lower eyelid fat reposition, where they take a little bit of the fat inside and move it over the orbital rim. And I will tell you, I don't do that besides technically being challenging and risky in my opinion. There are a lot of issues with it. The first of all is when I'm putting in fat, injecting fat in, I'm putting in 5 times, oftentimes, the amount of fat that I actually remove from the eye bag. So there's not a 1-to-1 ratio. So when you try to reposition the fat, it looks okay, but it's oftentimes not enough fat to get the results. So if you have a big eye bag, maybe you'll get away with it, but if you have a small one, you're probably not going to get away with it, and you're not going to manage this outer portion. There's oftentimes not enough fat out here to reposition it correctly to get that result. So to me, the best combination is taking a little fat out and adding a little fat back in. The entire time the eye is protected, and the fat is harvested from the belly and thighs, and injected very safely. If you read a lot about, eyelid safety in terms of fat injections, I get very, very safe results. I literally wrote the book on it in 2006. Been doing it for maybe 16 years now. So I get very safe fat results in terms of grafting around the eyes. And if I'm there, I'm doing the upper eyelid too, I will add some fat to the upper eyelids as well, no charge, if I'm sort of part of that whole process of doing both together. The fat persistence in terms of ongoing ability to hold, I do something called Pure Graft, and you can listen to that fat grafting talk or virtual consultation. But the Pure Graft oftentimes leads to very little swelling, unlike some of my recovery journeys that I used to shoot many years ago. Much less swelling with much higher retention afterwards. But there's always a chance you may come back and do a little bit fillers as you get older. But the recovery oftentimes is very short. Most of my patients don't have significant bruising or swelling, just a little bit of swelling, maybe a little bruising for a few days to a week, and there could be still a little bit after the first week. People experience a little bit of dry eye, which is normal. They need a little eye drops to help them that first week, and occasionally they have a little blurred vision for the first 2 to 3 days. But oftentimes not much pain, not much bruising, not much swelling, except where I harvest, there can be a little soreness in that area. So this is one more thing, I'm sorry. Oftentimes I will combine it with a little lower lid laser, with a cortex laser, which is a combined fractionated CO2 laser with erbium, just to tighten up the skin. So you'll also hear a lot of doctors will pinch the skin away and take out the skin. In my opinion, the pinched skin still has a risk of rounding or changing the eyelid shape. Also, it doesn't address the problem, because you taking a little extra skin along the edge of the eyelid first gives you an incision, but second of all, doesn't manage the crepey skin. I believe in fairer skin individuals, like up to Hispanic Asian, I will just do a light laser. It takes a few days to recover from that. And then you can we have a Oxygen X makeup that covers up that area pretty well within a few days. So it doesn't really add much recovery to the whole equation. But for lighter skin patients up to Hispanic and Asian, I'll just add a little laser as well. So that's my whole philosophy and technique for lower blepharoplasty or lower eyelid surgery.